discuss about one common question every mother or father should have and will have regarding the child's surgery is everything going to be all right with my child's surgery? This is frankly speaking, $1 million question, which every mother or father will have. So this will be continuously there in your minds till the surgery process is over. So I thought we'll discuss about this topic. Being a pediatric surgeon, this is one common question that all parents will be asking, and we'll be explaining in detail about all these questions related to that. So today I compiled all the questions in one frame, and then actually we'll discuss about this. Is everything going to be all right with my child's surgery? Pediatric surgeon for Kim's Cuddles in Hyderabad, Kompally, Kondapur, Secunderabad, and Gachibowli branches of Hyderabad. So regarding this, actually, I thought actually I'll do this presentation and then we'll discuss. And after that, if anything, doubts are there in the chat box, we can discuss later. So, what is the importance of a pediatric surgeon while doing a surgery for a child, and what is the special safety that a pediatric surgeon can give? This is very important aspect that all of us should discuss, because if at all, actually I always tell, if at all, if you have a gynecology problem, if you are getting pregnant, you won't go to an orthopedic surgeon or you won't go to a different surgeon. You know that it is a gynec related problem, and will you be coming to the correct specialist. So whenever related surgery topic for a child is there, you should be ideally coming to the pediatric surgeon. This is what is one of the things that I am trying to give awareness in the public, so that public should understand. Yes, my child requires the right doctor for my right problem. Suppose if the child has got some allergy, you should be going to a pediatric allergy specialist, and you should not be going to an orthopedic surgeon. You understood, no? So this is what I am trying to tell in this line. So why this importance is there? Because pediatric surgeon is a specialized surgeon. He has a specialized training, and he knows about the baby, which be it 1 month baby, be it 18 years old child. So the body is going to be totally different. We'll calculate the doses accordingly. We'll be treating the child accordingly. Psychological aspects are also different. The way I should talk to a 1 month old and 1 year old and a 5 year old or a 15-year-old should be totally different. I can't treat everyone in the same way. So apart from this, the body physiology also will be different. So for example, actually, if you know, actually for a less than 1 kg, 1 year old first infant babies, the blood volume, the body size, and the body fluid, everything is going to be different. And the same way, actually, for adult, near in adult, something like 18 years, adolescent age too. There also it is totally different. So we have to treat them totally differently, and we can't see all of them in same cup. So my bottom line statement I want to give is, the children are not just small adults, which many might be thinking, but it is not true. They're totally different. They need totally different doctors and different type of teaching, different type of handling, so different type of encouragement. So pediatric surgeons are well versed with this. So pediatric surgeon can take care of your baby very well. So coming to the safety of the surgery and what a pediatric surgeon role is. So this is what is the main topic that I want to discuss today, and it is very, very important. And coming to the safety in pediatric open surgery. So in surgery wise also, actually we have three types of surgeries. One is open, we have minimal invasive surgery. Minimal invasive surgery, we have laparoscopy, thoracoscopy, and vasectomy, or now latest technology is robotic surgery. So we, as qualified, experienced pediatric surgeons at Kim's Cuddles, we have the full range of surgeries, and we will decide which suits your child the best. So just because a mother asks, actually do a robotic surgery for my child, I will tell, no, for this problem, robotic surgery is not the right option. For this problem, operation is the right option, or for this problem, laparoscopy is the right option. There, because pediatric surgeon knows where is the safety of the child, in which procedure safety is there. So that's why we'll give and choose for you what is the best surgery suited for your child. So that we're going to guide you through this, and I'll take you through all these things. and some specialized surgical techniques will be there. So where kids are definitely at some special risk. So we'll be considering those special risks also, and then we'll be considering that and keeping that in the mind, and then we'll be reacting in the similar way. So sometimes parents will be asking, um, "Can I delay this operation, doctor?" Or sometimes some parents are like that, that whatever might be the reason, they just get delay the surgery. They won't get it done in the right time. So now we'll discuss actually what will happen if at all if it is not done in the right time. Sometimes some surgeries are there. Actually, even if you do it today or tomorrow or after 1 year or 10 years, it won't make much of difference. So, but because it is a problem, it should be corrected. We'll be correcting it. There are some conditions like that, but there are some conditions where it should be done as soon as possible. So, for example, appendicitis. Sometimes there is an intestinal injury, there is an intestinal block. So, in these conditions, the operation should be done as soon as possible, ASAP. So if you don't get it done at that time, what can happen? So I am telling you about emergencies. Emergency, if we don't get it done, yes, you're putting the baby at risk. So definitely in emergencies, this question won't come because emergencies, our reactions and the way we deal with will be totally different. We'll be doing it very extraordinarily, very well. And coming to the other things, actually elective problems. So sometimes what happens, some diseases will progress. So maybe if it is a small one, maybe if it is a 1 centimeter, 2 centimeter swelling, suddenly it can go into 10 centimeters. So automatically our cuts will be bigger, and the what we call it as a morbidity that is going to be more for the child. So we don't want this to happen. So that's why disease progression is one thing which can keep going on if you don't get it, if you delay the surgery. So sometimes it happens that, for example, we advised as a pediatric surgeon, pediatric urologist, we advised one kidney operation. So because there is a block or because there is a reflux. So if any in these two conditions, there can be ongoing organ damage, which can these things are happening unnecessarily your baby's kidney or whatever might be the organ of origin. So that will be at loss. So we don't want that to happen. As a mother, as a parent, actually you want to give the best to the child. So best to the child is timely intervention and timely action is the best. So let us try to give the best for the child. And sometimes it happens that actually there can be increased post-operative complications. For example, actually let us take this appendix as an example. Sometimes appendix, once it comes, it will keep on coming. That's why we call it as a recurrent appendicitis. If at all first time appendicitis comes, it is treated for whatever might be the reason without operation with medicines. So sometimes it can get cured temporarily. So in this process, after the operation is over, because of the inflammation, what we call it as there will be some small additions. If these additions are there uh, during the next operation, the operation is going to be difficult because there are some additions. So the more and more number of times. That's why, especially in girls, I always never give a chance for the appendicitis patient to be treated conservatively because right below the appendix there is a ovary. So ovary also can go and get stuck to the appendix, and then it can lead to future fertility issues. So that's why, especially in girls, I'll tell them actually waiting is not at all an option. So doctor notes, pediatric surgeon knows exactly when you can wait, when you cannot wait. So suppose actually, if at all, if we keep waiting. Suppose if it is an infective process, the infection levels will go up, and automatically your wound infection chances and local infection chances can increase. So when to delay, when not to delay, that also I wish you should go and discuss with the pediatric surgeon, and he is the right person to tell whether you can delay it. Sometimes, actually, frankly speaking, pediatric surgeons are the doctors who treat from heart. So that's why we know the family situation, we know the condition, we know the suppose for example, right now there is an operation, there is an exam going on for the child, which is very important. So kid should balance between operation. Kid also should balance between the operation and his exams or his important thing, like a football or something like that. If it is not an emergency situation, I usually tell, yes, go ahead, finish your work, and then come back to me. then I'll give you the best possible treatment possible. So this is how a pediatric surgeon thinks. So don't worry. Actually, if at all, if delay is required from your side, we will tell you how much and how long you can delay. So another most important doubt a parent has is, can my child take this surgery, doctor? Yes. I personally, this is my beautiful line that I want to show. Kids are the best set of patients. If at all, if a doctor should ask me, whom do you want as a patient? I will ask, I want a kid. I don't want adult. I don't want anyone else. Because adults little bit, they have something else in the mind. They'll be talking something differently. But kids are very clean and straightforward. Kids will tell, yes, I have this in my mind. I don't want this. I want this. He's very clear. And sometimes kid will be you'll be surprised to see my room. In fact, actually, kids come to my room and they won't go. They don't want to go out of my room. They'll be so busy. Sometimes they'll be asking their parents, "Shall we wait for some more time? Why should we go so soon? Shall we play with some more toys?" Because I have so many toys in my room, and kid will be very, very, very happy to stay in my room. So that way, kids we have lovely time as pediatric surgeons with the kids. And other thing is kids tolerate surgery very well. And luckily, kids they don't have any comorbidities literally. So that's why their healing will be perfect, their recovery will be perfect, and they are going to have a smooth journey throughout this kids operation. And whenever a big patient comes, what I personally do is I will try to stoop to their level. So sometimes they're intellectual as well. Maybe I have to go there. But usually, luckily, and kids, their understanding, their capacity is different according to the ages. A 1-year-old child will be totally different. A 5-year-old will be different. 10-year-old will be different. He'll be thinking twice before opening up. A 15, 18 years old, he'll be listening to everything, but he won't open up at all. So these type of people should be taken into confidence. Only after he wins my confidence, he'll be ready to open up. He'll be ready to talk. He'll be ready to tell what is his real problem, and then I can continue my consultation in a proper way. And same way, while explaining the operation also, for according to the age, I have to discuss to the child also in a different way. So a child of 1 year, yes, I need not tell much. He'll be busy, playful. Till literally 3, 4 years or 5 years, they'll be playful. They'll be busy with their work. I can do my consultation part comfortably. But 10, 11, 12, 13, 14, 15 teenage boys, it's very difficult because whatever word I utter in this era of AI technology and all, so immediately they'll be going and searching. And actually, I have one child uh, earlier when I was practicing. So he was sitting in front of me. He had a cell phone in the hand, and the moment I uttered a word, actually immediately he was searching that. So it is a tough time for a doctor to discuss in front of these type of kids. So that's why what we tend to do is actually either we'll call the parent to come again in a second counseling, or we'll tell the parents actually to go tell the kid to go to a playroom or some other area, and then I'll continue my discussion with the family. And these are the kids who are very dangerous. Actually, we should not be talking in front of them. It is very tough to discuss with these people. So all the kid needs is a mother's touch with love. That is most important. So I tell after the surgery is over, I tell the mother or father to just hold the hands of the baby, just to give a confidence, telling that I am with you, I'm here only, I'm not, you are nowhere, you are here only with me. So because during surgery, what happens in that 1 hour, he doesn't remember what happened to him. So this 1 hour, he doesn't understand what is happening. So this partial memory loss is going to put the child into more and more confusion. So that's why post-operatively, actually we'll advise the child and the family to console each other, to tell the child that yes, I am here, don't worry, I'll take care of you. And most important, kids don't like too much of attention. Uh, it's exactly contrary to the adults. In fact, adult who gets operated, he'll expect something from his parents, something from his wife, something from his children. So that way, kids are totally different. In fact, he wants him to be left alone. So no extra attention should be given to him. So let the kid, allow the kid to do his daily activities in a daily way, and there should be no restrictions to whatever he is doing. So this is very important in a kid's operation. Pre-operatively, so many doubts will be there in a family, father, mother, be it emotional, be it financial, be it psychological, or so many apprehensions, so many fears. So I always tell all the parents that you ever come for a consultation, come for as many number of counselings as well, but don't come for a surgery with any of the doubts unclear. So that's why it is very important that clear all your doubts before coming to the pediatric surgeon for surgery. Af- So let all your doubts be cleared in the previous consultations. So more doubts will lead to more confusions, more complexity, and in turn will lead to more stress for the parents. The more stressed a mother is looking at the child will not be ready to come for a surgery. So everything should be perfect and clear. So after the operation is over, at least what are all the doubts that a parent can have and should have? So a mother invariably will ask about the wound care. What should I do? Should I get the dressing done immediately? Where should I get the dressing done? But I always tell most of the dressings, clean dressings, done in the operation theater are the best dressings. So we cannot equate with the dressings anywhere in any of the dressing rooms. So that's why I tell most of the families don't get any dressing done at least for whatever time I tell. Usually it might be a 1 week time. So 1 week later, they'll come for review. I will only remove the dressing, and then I will tell the parent that yes, everything is perfect, or we'll tell what it is. So coming to the diet, so every mother asks, "Can I feed this? Can I feed that? Can I give this? Can I feed that?" So over that, grandparents' superstitions will be there. You should not give that. You should not give this. You should not give that. So, as pediatric surgeons or in the modern era, there are no diet restrictions for any operation. All that we'll tell is because we are giving antibiotics and painkillers, these can add to the acidity. That's why we tell them don't give too much of acid producing things, something like uh, our pickles and too much of spicy stuff, too much of oily fried stuff. These things we try to avoid. But rest all, everything can be given for any child. So, if at all some surgeries are there where intestine operations are done, so then doctor will tell, don't give anything further till this time, till the intestines are ready. So that is very important. And sometimes when we are giving some foods in those kind of scenarios, usually we'll tell them first start with liquids, then we will give some more liquids or something like milk, and then only I will tell them to go for a semi-solid, then solid. So slowly we'll take according to the intestine's capability to adjust to the food requirement. And for example, in a case of intussusception, so where the intestine has gone to other intestine, in these conditions alone, we tell them some dietary restrictions. And we tell them not to eat anything new item in intussusception for at least a week or 10 days. Then they can start one item every week, but not all items together in 1 week. So other thing is, can my child go to school? So frankly speaking, I tell most of the parents he is not going for any higher education. He is just going for some LKG, UKG or something like that. Yes, the school is important because he's going to miss the friends. He's going to miss that environment. But there are some kids who may not choose anything. But either way, doctor knows exactly when to restrict the child. Frankly speaking, I tell them if the same question any parent asks, I tell them tomorrow child can go to school. So if school is very important, if that period is very important, if that phase is important, but problem with school is it is not with your child, it is with the other kids. So they will ask, yes, you got an operation done. Show me what operation you got it. So it is very embarrassing for the child. Maybe if it is a co-education school, it is still more embarrassing. One. Second thing is kids of the peers. Peers are usually friendly, playful, and ready to fight. So these kids can cause more trauma to the child rather than your own child. So it is not the problem with your child, it is problem with the other children who might be thinking this fellow is a normal child, I can play with him in any way. But they don't know that this fellow got operated. So that's why I'll advise them some school rest. At the same time, not too much of loss for the school. So other question most kids may ask is, Doctor, can I play? Doctor, can I go for cycling? Doctor, can I go for a bigger child? Can I go for my cricket classes? Skipping, whatever, skating, so swimming. So these things, in some surgeries, we have some restrictions, but usually after 1 week, usually we'll try not to put any restrictions on the child. So he can resume his daily activities, daily playful things he can do very well, comfortably at his home environment. So most important bottom line question is, when will my child recover fully? That's for that. Usually, I tell most of the parents after the first week, the child will be comfortable and he'll be. You can take it for granted that it is a complete recovery. But normal complete healing takes place somewhere between 6 weeks to 6 months. During this phase, it is better you take little bit of precautions. So there should not be kickboxing, there should not be any unnecessary fightings, and there should not be excessive weightlifting or excessive. Excessive means a school bag is okay. Anything beyond that is not bad, not correct. So that is what we tell. But kids usually they don't do much of excessive strenuous work. So before and during operations, so much of parental counseling is required. As a pediatric surgeon, we spend hours together. So many minutes I'll be spending with the family. So I usually see that all the doubts of the parents should be cleared, and they should come to a surgery only with a clean mind, with no doubts at all. Yes, there are complications and on sequelae for some operations, but truly speaking, it is a doctor's headache, not a parent's headache, because you cannot do anything with that procedure. We are specialized after general surgery, 3 years of general surgery, after that 3 years of pediatric surgery, and after that at least 20, 25 years of decades of practice. We know exactly what to do, how to do, and it is purely our headache to take care of your child in the best possible way and hand over the baby back to you in a beautiful way. So, coming to the operation, stomach should be empty because when we are giving anesthesia, everything will be relaxed. So during that times, if stomach is full, so sometimes some parents will think, "Hey, what is there? Like, I just gave a biscuit, I just gave one milk, and I just gave some water," and they they think it is not required to tell the doctor before operation. It's very important to tell the doctor before operation because stomach should be completely empty, or else the moment anesthesia is given, the stomach contents can go up and it can spill into the lungs, which can lead to pneumonia, which can be life-threatening. So be clear with your doctor and don't hide anything with your pediatric surgeon. And one other thing, actually, I always tell all the family members is, if at all, if your child develops cough, cold, or fever, just a day or two, or even on that day before surgery, you can straight away cancel the case operation and then inform the concerned doctors, telling the doctor we are not able to come because cough, cold, fever is there. Because when all these things are there, it's better not to plan for surgery because the child's chest, child's respiratory efforts will not be ready to take the major general anesthesia and surgery. So on the day of surgery also, so much of guidance will be given by the nurse, by the doctor, or by the anesthesia colleagues also, who will be telling, briefing little bit about anesthesia, what they're going to do, and then they'll be taking the baby inside with so much of love and compassion, more than a parent can give. And with that, we'll be taking the child inside, we'll be doing the surgery with so much of effort. Frankly speaking, surgeon puts more than 100% effort to do any operation to give the best possible outcome for the baby. So this is going to be a promise of a pediatric surgeon, and then we'll be doing the surgery. And while handing over the baby, and after the anesthesia comes out of the anesthesia effect, so we'll be briefing the parents about how surgery went on, and what are the things you should be doing, what are the things you should be expecting, and how to take care of the baby in the post-operative room, which is a tough time for the family because actually he's just recovering from the confused state of operation and the confused state after forgetting what really happened during this operation time. Because we gave full body anesthesia, so child doesn't know what happened. All he knows is he went inside, he came outside. So what happened in between, he doesn't know. So that's why I tell parents, don't tell the child your surgery went on very well. It is not what a child requires. Child requires wants to know that my parents are around. I'm in the safe environment. Yes, he knows the pediatric surgeon very well. Even then, he wants. So so after the surgery is over, another question a parent can have is, are there any long-term consequences after the surgery or after because of the anesthesia or because of this episode? So we'll discuss about this. So coming to the operation, it is little bit of scary environment. Till that time, he's in a playful environment. Suddenly, on that day, he'll understand that it is not a very playful area. So people will be troubling me because actually we'll be putting an IV line to give IV fluids, and we'll be giving an anesthesia, and we won't allow the baby to move comfortably immediately after the operation. So these things will give him a bad experience. But good part of any human brain is they'll forget. So kids forget very fast. Within 2-3 weeks, he'll be perfectly fine and he'll forget about this actually scary experience or anything. And then in the meanwhile, actually a good parent will be telling, so whatever we did, it's only for your good. And luckily your problem is gone now. And you're comfortable. You can do this, you can do that. So show him the positive aspects of getting your operation done. So it is very important for a family to prepare the child also equally well. It's not only your preparation, it is a preparation of the child also, which is important. So those things also should be considered. And this is the emotional aspect of the child. And coming to the physical aspect of the child, yes, after any operation, we are going to leave a scar. So to give the best possible scar, what we tend to do is actually we'll be giving you some ointments and I will be telling you to do massage. In some time back, I told any complete healing will take anywhere from 6 weeks to 6 months. So during this 6 weeks to 6 months, the body will be having that area will be having some healing agents or healing members. So these things, what will happen is sometimes they'll start overgrowing. So sometimes it can lead to what is called as a hypertrophic scar. So to prevent this hypertrophic scar and all forming, what we tend to do is we do what is called as a massage. So these massages actually ideally will be advising at least for 6 months, 6 weeks to 6 months. So some parents will be asking, doctor, this much of time is required. So yes, it is required. So if you are interested in giving the best possible scar for your baby, yes, you should do this uh, massages with the ointment that we are going to give, or even sometimes actually just a simple ointment with the coconut oil. That is also equally good. That will give you a very good scar. So doing a surgery and getting a scar, in between so many things are happening. So to take care of these so many things factors, so massages and wound care is very very important. So sometimes if we do abdomen, tummy operations for intestines, so whenever intestine is touched, it will get a new property of what is called as adhesions. Adhesion means one intestine getting stuck to the other intestine. This is what is called as adhesion. So if adhesions are there, so it is little bit tricky. So simple additions, one by the side of the other one is simple, easy, no problem. But if the intestine is going like this in acute band and it is getting stuck to one area, this is when sometimes it will lead to what is called as an adhesive obstruction. So these people can have recurrent pain abdomens and big vomitings can be there. Sometimes green colored bilious vomitings, what we call. So these things can be there. So additions are something that you should be keeping it in mind and then taking care of them separately and specially. So, to continue about these additions only, the easiest way, prevention is the best cure, as all of us know. So the only way you can prevent addiction is by seeing that the child is not going into constipation. So post-operatively, our dietitian and we also give what is the dietary supplement. If at all, if we are lacking, we'll try to tell what should be added on. So in this, constipation should be prevented on, and no child should be constipated. So the easiest way to prevent a constipation is give him adequate amount of water every day and give him more fiber. Fiber is there only in green leaves, vegetables, and fruits. So these three should is a mandate for every child: green leaves, vegetables, and fruits, apart from water. So and over this, proper bowel training is something that we should give, and we should teach it after 3 years of age. Till 3 years, it no need to teach that. So any after any operation, actually your doctor might be telling, actually your pediatric surgeon will be telling you. So what are the symptoms you should be watchful about? For example, intestinal operation is done. Suppose if vomitings are coming, and if at all if the vomitings are green colored, yellow colored, definitely it is an indication that you should go and come back to the pediatric surgeon and come and meet him once. So if at all if the tummy is getting bloated for no reason, so those conditions also, yes, you should be going and meeting your pediatric surgeon. So sometimes wound infections can be there. So because if you are doing an intestinal operation, intestinal contents actually they'll be getting contaminating the wound, so that can lead to wound infections. Or sometimes it happens that the child's immunity itself is very low. That whatever you do, actually wound is going to get infected. So this is some common sequelae where you can get wound infections, and usually we'll tell them actually how to take care of all these things. And we, as pediatric surgeons, when the patient is getting discharged, will give you so many precautions before you're getting discharged. So my sincere suggestion is just follow blindly whatever a pediatric surgeon has told you regarding the child surgery and aftercare. So you should be following that advice sincerely. As a mother, will I get some support? This is one important estimated, because all of us know that actually mother is the strongest lady of the family. Mother can do anything. A child knows very clearly, my mother can do anything. My mother can cook this, my mother can do work, my mother can do this shopping, my mother can get the money, my mother can do this job, my mother can do that job, and my mother takes care of everything in the house. Everything is run by my mother. But unfortunately, on that day also, a mother is a mother. So she is emotionally totally down. So this is when family should be taking care of it. Family should be giving the utmost support. Apart from that, and a child's smile itself will give her more courage. And over and above this, a pediatric surgeon gives so much of confidence. Actually, I am there for you. I am going to take care of your child. Don't worry at all. It's my responsibility. So few words like this from a pediatric surgeon's mouth is going to give more confidence to the child, mother, and the family, of course, the child. And seeing the smiles on the mother's face, only the child can go into the operation theater more confidently and strongly. So, from the first counseling, actually, though, actually, family will be taken overall as one into consideration. We at pediatric surgeons, we know mother is the one who is going to take it to the maximum extent. So that's why we clear all her doubts clearly before coming for the operation itself. So this emotional guidance will be given to all the family members, especially the mother, throughout this journey, and we'll be hand-holding your child, and we'll try to give the best. So, so all your doubts will be cleared. As a mother, don't worry at all. And after the surgery is over, initial follow-up is initial dressing is over, everything is fine, looking fine. So one important question is, should I be on follow-up? How should I follow? So it's very important. So frankly speaking, for every operation, actually we have a workflow. So pediatric surgeon tells you what is the workflow. So after the operation is over, what you should do, when you should get the next scan done, when you should take care of the baby, when you should bring the baby back for a revisit, and is it necessary or not. And we Kim Schedules, we provide actually online consultation also, as well as for those families actually who are not able to attend, who are not able to come immediately. So these are the things actually which are included in the workflow and which will be given to you in detail by a pediatric surgeon, and that is our responsibility. So all that you should do is whatever actually doctor tells, just blindly follow it, because doctor will think twice before putting it on pen and paper. So and before uttering that word. So try to do whatever actually he advises and sincerely follow them. So sometimes we miss the dates, miss the month. It's okay. Actually get it done then also. And be in touch and follow. And then we'll try to give the best to the child. So, and this is most important, actually follow the advice sincerely and clearly and definitely, preferably on time. That's very important. And apart from all these things, any doubts are there. So in KIMS Cuddles, actually we have a pediatric surgery coordinator number, that is this number. But in most of the places, actually, your pediatric surgeon will be giving you a number actually on which you can call if at all, if any doubts are there. I always tell like most of the families, usually a family doesn't call me just like that. Hi doctor, how are you? Did you have food or lunch, dinner? They'll never talk like that. They'll talk what from the emotions. They'll talk because they have some problems in the heart. They'll talk only when the problem arises. So that's why actually we give this number actually anytime. So recently and soon I'm going to start one anytime pediatric surgery, ATPS service, and this is very important for a family. And coming to the scars, so unfortunately, be it a boy, be it a girl, be it on the face, be it anywhere, so many parents are more concerned about the scars. Fortunately or unfortunately, yes, scars are important, but we are not gods. So after the operation, yes, we are going to leave a mark. So what we are trying to do is we are trying to give you the best possible outcome, best possible marks on the baby. So for that, actually, doctor will be advising actually some ointments and some massage, so that you'll be getting the best possible scar for the given operation. So we'll be also be checking. And but scar, if at all, if you want to make it beautiful and good looking, first 6 months of massage is important. After 6 months, whatever you do, the scar is a scar. You cannot change the status of the scar. So, and scars also, even in invasive surgery, actually we'll be going through one hole, and then those scars are also equally important. But we'll try to make it as minimal and as minimally visible as possible. That's why, for example, laparoscopy and robotic surgery, usually what we tend to do is we put one of the boards through the umbilicus, because umbilicus it will get submerged and literally it won't be seen outside. So that scar won't be seen in the abdomen. So, and pediatric surgeons, you just believe me, we will try to give the best possible outcome, best possible scars available and possible. And that's why our cuts are small. The the way we take the incision means cut itself is totally different. So we'll never try to cut the abdomen in a vertical way, because it will give a very bad scar. So and that's why we follow what are called the Langer's lines. So these Langer's lines actually they'll be having actually lines exactly will be going in this planes only, which will best possible scars. So just possible. So bottom line and most important word is listen to the doctor's advice carefully, sincerely follow it blindly, because a pediatric surgeon is giving his advice after thinking twice to give the best possible outcome. Because if in your result only my happiness will be there, in your result only my success is there. So your kids' happy smile is the most rewarding thing for a pediatric surgeon. So that's why we don't want any rewards, we don't want any accolades. So all that we want is a beautiful smile from a child. So of course, in the initial period, he'll be crying actually sometimes because he knows this fellow is the one who hurt hurt me. So even then, I always expect one smile from the child, from the family, after they go back, after a week, after 2 weeks or 3 weeks in the next follow. Yes, he should be able to recognize you and feel happy to meet us. So Safe surgery for every child is this year's our pediatric surgeons' goal. And pediatric surgeons make it possible. That is what we are made for, and we do it sincerely from our heart. So, in the process of giving this safe surgery, if at all, if you are still having some doubts, you please go and meet your pediatric surgeon. And as pediatric surgeons, will be there round the clock, anytime, if at all, if you have any emergency. Usually, parents will, I again tell you, parents will never call a pediatric surgeon just like that to wish a happy birthday or happy new year. They will call only when there's a trouble for the child or their neighbor or their sibling or some other person who is having the trouble. That's why we always leave our note of our pediatric surgery coordinator. At Kim's Cuddles, actually, our team has got this coordinator and the number which will help you in taking care of all your doubts. If not immediately answered, it will be taken care of within 24 hours and your problem or doubt will be resolved. So, my suggestion for all the parents is come with a open mind and listen to the doctor carefully and make a point, not a bit of first, and then don't come for a surgery with any doubts. So a doubt-free mother will always have so many doubts in her mind. So let us be very clear, and now I am promising you that everything is going to be all right, and don't worry at all, and we are going to give you the best. So as a pediatric surgeon, this is going to be our promise, and now I will just see the chat box if at all, if any chats are there in the chat box. So here, one parent is asking, what is the best way for a parent to talk to their child at different ages about the upcoming operation? Frankly speaking, this is a very important question, and this is where our support is required, and we are going to support you. And of course, actually, online also you can know something, but mother knows most of the time how to deal with that child. And most important is you should divide the child's age, and accordingly you should be able to talk. A 1 year old child, all that he needs is a mom's love, and he doesn't require anything beyond the mother's love. So means you can tell him in the way he can understand. In a similar way, if at all, if it is a school going child, 2, 3, 4 years, 5 years old child, all he needs is your doctor is going to take care of your tummy because you have a problem with your tummy. So he's going to settle that problem. And you need not give a technical term for all these things. All that you should tell the child is he is going to take care of your problem. This is a problem, he's going to take away your problem. So this is the easier way of telling it and in your own style. This is the background on which you're going to build up your questions, your counseling. And if at all, if it is a 8 to 12 years old child, he can understand, but he won't be able to understand completely. So that's why you should tell him little bit about anesthesia, little bit about fasting, why the stomach should be empty, little bit of an anesthesia. So what is the operation? And after the operation, some pain will be there. All these things can be explained in a subtler way. But a 15 to 18 years old, he knows literally everything, especially in this generation kids. So you have to tell them in detail, little bit more about the surgery. And my sincere suggestion for all the families is don't try to show too much. Don't try to tell, go and search the videos. Videos will explain all these things. So that is very risky thing. And because Google or internet, its work is to tell anything from A to Z. But you don't require A to Z. Suppose if I'm Yoga Nagendhar, all I need is your YOG and Yoga Nagendhar. That's all I want. So it's like searching for a word in the dictionary. So only that much should be taken. But unfortunately, the internet access, all these things will be giving way beyond the so according to the age, you try to explain. Sometimes some kids may require more time. Sometimes some kids are ready to accept it. So if at all, if he is taking some more time, you can tell the doctor, my child is going to take some more time. Can I wait for some more time? Can I prepare the child? And over and above this, if at all, if you are not able to explain to your family, then we are there for you. Bring the child to me. You tell, actually, doctor, he's getting scared. Doctor, he did not understand. He has some doubts. So actually, interestingly, I had one child, and he came with a big list of around 10 or 15 questions. Means the questions were really interesting. Unfortunately, I don't have it, or else I would have put in this presentation. So he asked me when I can play, when I can do this, when I can do that. Actually, is it okay? Can I eat biscuits? Can I eat chocolates? In this bargain of discussion with the child, a pediatric surgeon tells him, you can do this, you cannot do this, and this is good for health. And we can teach him actually what is a good fiber diet, what is a good way of eating. All these things also I can tell. So interacting with the child is very interesting. Actually, in fact, frankly speaking, I always tell you think that we are teaching the kids something. In fact, actually, after seeing my children, after seeing my kids, what I understood is I learn more from them. This is not a teaching age. It is in fact actually we are students for the lifetime. You'll be learning a lot from them, including your own siblings, your own children, your own kids. So you'll be learning a lot. So that's why I always tell, actually, we have a saying, actually, you should become a mother or a father to understand the pain of the child. Till that time, you won't understand why the child is crying. So to understand the child psychology, first you should become a doctor, mother or father. So only then you can be a good doctor. So luckily I'm one. Luckily this will be my bronze. So here we have one more question. What is the approach to pain management in a child after surgery? After surgery, immediate after surgery, we have so much of pain. So that's why what we do is we'll give so much of painkillers actually in the initial period. During the operation itself, the anesthetist will be giving some painkiller. After the operation also, we'll be adding on some more painkiller. And within the first 24 hours or 48 hours, the pain will be more. Later on, actually soon, the kid will be using the medicines, pain medicines prescribed by us, and slowly the pain will start coming down. So added to this pain, the apprehension is more. So that's why maybe it will hurt me is one reason for the pain, more pain for the child rather than the real pain. So that's why pain is one important aspect which we consider it seriously, and then we'll try to give the best possible painkillers. But sometimes some parents will ask, doctor, give me some more painkiller. Why is my baby crying too much? Frankly speaking, I means the baby is very good. So a good talking baby, if at all, if the child is interactive, crying too much, that's a very good thing for the recovery time. And we will be giving the painkillers, and then accordingly the pain will reduce significantly. So this is going to be our problem. Actually, we are going to give the best to the child and family. So here we have one more question. What can parents do at home to best support their child's recovery and healing? So in first few slides, actually, I told clearly that child is one special set of patient who doesn't want any excessive pampering, and you should not stop him from doing his regular activities. So the more and more you try to stop him from doing any activities, the more and more he'll become more cranky, the more unsupportive. So the best thing is that's why actually we'll try to do more of daycare operations so that actually the child can be sleeping back in his bed. So that is the best place for him. So in his environment, in his house, with his family members, with his grandparents, with his toys. So that is very important. So this helps in the speedy recovery and the better the early recovery from the process. And other thing is uh, coming to the healing. Yes, you should be giving the best possible healthy food as available. So some parents must have promised, I'll give you a pizza or a biscuit or ice cream or cake after the operation is over. So all these things are not very healthy items. So you should try to give the best, less infective, infection creating, and more healing capacity of food items as possible. Most of the operations, we advise them to give good fiber diet, adequate water, and high protein diet. So these are the three things that which are very important in pediatric surgery. So so, as pediatric surgeons, we are going to take you through this journey, and we'll try to give the best possible support. And we are going to take your child's surgery journey, you and your family and your child, in a very safe, perfect, well orchestrated manner. And we are going to there. We're going to be there to support you continuously in this process. And any doubts you have, I always advise go and meet your pediatric surgeon. That is very important. So we are going to take you through this journey, and we are going to take care of you. So don't worry at all. We are there for you. And this is a pediatric surgeon's promise. I am Yoga Nagendhar, Chief Pediatric Surgeon from King's Cuddles, Hyderabad.